Probably the best way to start a presentation for Roger is to do this. Put up the dog. We want to thank you for being here today and for all that you're doing to fight this disease. Every year we look forward to this, but this one, really, next slide shows you that some patrons here are giving in other ways. That's maximum sacrifice until it hurts. So thank you very much. Now we're here to support the most rapid application of the best science that we can muster that comes out of David's laboratory and others to immediately improve the quality of life and survival for patients with advanced pancreatic cancer to get more of those sunsets. We'd like to cure this disease, to early detect it and prevent it. I'm just going to say a word or two because this tournament brings back many memories. Many memories indeed. Many special memories. And there are other people here today from other organizations, which was also the dream, to have other people from other organizations here. They're out there raising money against the disease, and we thank them. This tournament is also hard for many others because it brings it back together to honor the memories of so many lost to pancreatic cancer, and I'm sure that there is a tremendous rush of memories, as I certainly feel. And we honor many more that we've lost this last year, and honor many more. So many vital people. We're also here to fight for those who are actively fighting pancreatic cancer. And the good news is the number of those survivors is growing. They're all-stars, some pictured in all-star garb here. I'd like to provide a brief summary of two major accomplishments made this year against pancreatic cancer. Number one, these have been made possible by your support and by so many team members who are here today at the various tables. I thank them that I have the honor to present these. Accomplishment number one, new effective therapies for two rare types of pancreatic cancer. As an example, acinar cell. Only 5% of all pancreatic cancers, but that's a lot of groups of 40s, even at that. This group has published a new effective treatment for that type of disease with your support. Another rare type of pancreatic cancer, ampulla of Vater. It's the tip of the pancreas and the gallbladder duct, and about 3,000 people get it per year, 300 die. And if you have an advanced disease, your 5-year survivorship is only 47%. Through the team at TGen, the whole genome sequencing, that's 3 billion base pairs. That's the number of pulses you have in your life if you live to 72 years of age. 3 billion base pairs. You come up with a picture that looks like this. They're called circus diagrams. And we found that the ampulla of Vater cancer is a dumb cancer. Those are the ones that Dr. Tuvison and everybody's looking for. We want the dumb cancers because maybe only 1 or 2 driver mutations. You hit one and the cancer dies. So we treated a patient with a new oral targeted anti-cancer agent against a specific driver mutation. And this picture shows, just like the PET scan that Dr. Tuvison showed of the mouse circulating, you can see here's the heart, but here's this tumor, ampulla of Vater, in the patient's area here. It's right near the pancreas. You can see here, and it got better in a very short period of time. Well, this particular response now has lasted more than 20 months. A patient of Dr. Ramanathan's, who's down here, and this is a dramatic result, and he said it was okay to show his picture. By the way, the drug did not cause his hair to turn blonde and long. He just put that on for effect. The drug basically has no side effects. There may be other rare cancers of the pancreas, but advances, these may be rare, but advances against these rare ones can save lives if people simply study them, and we wish others could have been saved. But what progress have we made against the most common type of pancreatic cancer, the ductal adenocarcinoma of the pancreas? And that's accomplishment number 2. I'm looking at so many who have lost so many with this particular type of cancer. Well, with a combination of gemcitabine plus nab-paclitaxel, first reported at this tournament, we were able now to report the final results, and it came out a couple of days ago. Remember, we first reported that the preliminary clinical activity of this regimen was fairly stunning in that the tumor marker in the blood called CA19-9 went down in all patients. And the team saw dramatic decreases of tumor in the lung and in the liver on CAT scans. In fact, in a few patients, there were complete responses, all the tumor gone in a few patients. The summary for today of that work, the final results, is that the 1-year survival for patients with stage 4 metastatic pancreatic cancer is now 48%. It was 18% in the past with gemcitabine, or 2% with no treatment. And we can announce now for the first time here that the 2-year survivorship on this therapy is 25%. Last year it was 0. And worldwide, many patients are surviving beyond that time. And in case you don't realize it, this regimen recently worked for a 31-year-old woman who developed advanced pancreatic cancer while she was pregnant. She's still with us. We're rapidly trying to improve on the results by bringing the best possible talent and minds in science to bear on this issue. And David and so many of my colleagues, actually from all over the world and in this town too, from Princeton, Penn, Salk Institute, Memorial Sloan Kettering, are working together to try to put the next best science into this regimen of gemcitabine nab-paclitaxel. And I will tell you, just like David said, there's an incredible amount of science being generated that needs to be tested, and fast. With your support, the Pancreas Cancer Research Team is in place to rapidly apply that science. And I guess it's like Mr. Colangelo said, I wish I'd have met Roger earlier, because when you really look at the tremendous talent, there's 45 institutions and hundreds of investigators all working together to test these regimens from all over the world. Brussels, the Netherlands, all over. We have ongoing clinical trials, but not enough of them. We're moving this gemcitabine, ABI-007 it's called, or Abraxane, forward in preoperative to try to have patients be more often operable. And Dr. Ramanathan is running that trial. Of course, by having PCRT, we can do it much faster and get a faster answer. And I won't go through the others except to say the last one on the list is the Seena 1 trial, a major effort putting everything we know against this disease. Gemcitabine and Abraxane, followed by FOLFIRINOX. We call it a relentless pursuit for an individual patient. But finally, you've seen the statistics for something developed with your support. Now I'd like to introduce you to some real people fighting this thing together with your support. The Purcells, Patricia and Peter. And fighting this thing together with your support, the O'Neills, Karen and Dick O'Neill. It's my pleasure to introduce Patricia Purcell. I couldn't say that a lot of times. Patricia Purcell, great to have you here, Nurse Purcell. Come on up.